Assalamu alaikum and welcome back to the mid-morning talk with me, your guest presenter, Sadia Ransedi. Our last and final, but one of the most important interviews for today is an interview with Sister Attiya Dadabhay, who is an audio and speech therapist. Assalamu alaikum and welcome, Sister.
Walaikum
Walaikum
salam.
salam.
Jazakallah for having me on the show.
Jazakallah for accepting and honoring the invitation. So, sister, what has inspired you to offer this free hearing screening in support of World Hearing Day this March?
Okay, so we are having a free hearing screening for the month of March at our clinic, Crown Med Day Hospital in Fordsburg. I think what inspired it was firstly World Hearing Day. So World Hearing Day is celebrated on the 3rd of March every year. And the aim is to prevent hearing loss and ensure equal access for all individuals. So my aim for the free hearing screening was to make it accessible for everyone to come through, check their hearing status, and if they do have any issues, to get the help and intervention that they need as early as possible.
Okay, Alhamdulillah, and Jazakallah for this. So, why is hearing health often overlooked compared to other areas and other areas of preventative care?
Okay, this is a very important question. So I think there's still a very big stigma around hearing and hearing loss. I think it's also often mistaken for something else or a different condition. So sometimes children might not be hearing or responding and they're labeled as naughty, or adults might be withdrawing from certain social situations and they're labeled as, they're just getting old, they just want to be by themselves. But a lot of the time, it's because of a hearing problem that they're not able to integrate into the social settings, or children are not coping in the classroom setting, or not developing language and speech appropriately. And I think the first port of call should always be, let's check our hearing status and see what is happening with our ears and whether or not that's contributing to any difficulties we may be experiencing. And I think that people are very open to, checking their eyes and getting glasses or whatever needs to be done for their eyesight. But when it comes to hearing, they don't want something on their ear that people can see. They don't want people to know that they can't hear. However, it's the same thing as wearing glasses. You need to make sure that you can hear properly so that you can integrate into society, you can cope well in social situations, at school, or in any other situation.
Okay, Jay, that is insightful. Yes. So on this poster here, the poster that's advertising the free hearing screening, uh, it's mentioned that the common warning signs of hearing loss. Okay, they are mentioned on the poster. Which of these do you see the most in do you see the most with the patients that come through to your practice?
Okay, so I think we have different populations when it comes to hearing loss. So I think that's also important for everyone to understand that loss is not only applicable to your older population or your older people. It's applicable to anyone of any age. So when it comes to your children, sometimes you might notice that they're not developing language properly, they have frequent ear infections, they're not pronouncing speech correctly, or they're not coping in the classroom setting. Those are most of the children we see that might have some hearing difficulties. It's also important for newborn babies to screen their hearing at birth to identify if there's any issues as early as possible. And then when it comes to our older population or our adults, most of the time they mention that, when they're sitting in a setting, they're not part of the conversation. They can hear that people are talking, but they can't pick up what they're saying. And most of the time they're not included in the conversation or they can't contribute to the conversation. And as people get older, it's also when someone's not sitting in front of them, they can't hear what they're saying. So I think those are most of the common signs that we notice for people coming in to check their hearing. But sometimes hearing loss can be gradual. It doesn't happen overnight. And your brain and yourself is so used to adapting and, developing strategies and compensating for the fact that you're not hearing, that you don't notice how your hearing is decreasing over time. So it's always important to get a routine check, especially once a year, if you don't have any concerns, just to make sure that your hearing is not deteriorating.
Okay. And then you briefly mentioned that of the different populations. So we've got this perception that it's only for elderly people. How accurate is this perception?
So it's not accurate at all. I think older people is a portion of people who experience hearing loss, but hearing loss can be experienced by any individual from a newborn baby up until an old person, and it can be from a variety of factors. Sometimes hearing loss has no known cause, and sometimes individuals just experience this hearing loss. But some of the common causes of hearing loss, especially in children, would be your frequent ear infections, viral infections, meningitis, or injury to the ear. And then in your older people, it's more common because the hair cells in your cochlea start to deteriorate. And we notice just like every other part of our body starts to degenerate, so does your hair cells in your cochlea. And this is what we call an age-related hearing loss. So those are some of the common factors, but like I mentioned, it's not only your older population that experience it. It can be due to a variety of factors, and it's important that every individual at every age check their hearing. And I think the school age population is also very important, especially since they're going into the school setting. They're required to cope in what we call noisy environments, many people talking, to be able to follow instructions. So I think going into the schooling environment, it's always important to make sure that there are no hearing concerns before entering the school setting.
Okay. Okay, so for someone like myself who's working in a noisy place, I spend most of my time wearing either ear muffs or earplugs. And then you also mentioned that the hearing loss, it gradually goes unnoticed. So how or rather why does this make screening so much more important?
Okay, so I'll answer that question in two parts. So the first thing, which I did actually forget to mention, is that noise exposure is really a big contributor to hearing loss. So we need to practice safe learning practices. So I'm glad that you're wearing the ear muffs or the ear protection in those noisy environments, because a constant exposure to loud noise over time can also cause your hearing to deteriorate. And then I think for the second part of the question is, I think that why it's important to check your hearing is that sometimes you might overlook it, or you might not know that there's a hearing problem or that your hearing is slowly deteriorating. And then only once it's a point of where you really can't participate in a conversation or where you're really isolated, that's only when you come and seek help. But I think the more you monitor it and you do regular screening, it helps to intervene or to come up with a management plan as early as possible to get the best outcomes possible.
Okay. Oh, Jazakla, this is so informative, and we need to just take an ad break quickly, and we'll come back and continue. Stay tuned.
Salam Media, your spiritual companion this Ramadan.
Imagine fasting and not knowing you'll have something to eat at iftar. This is a sad reality for thousands of new and indigenous Muslims in Southern Africa. Each Ramadan, for over 20 years, the Islamic Dawah movement has been providing iftar meals in over 50 township masjids. All it takes is 30 Rand per meal. 30 Rand provides an iftar meal for a fasting person. Your help would make a world of a difference. Call IDM on 031 304 6883 or visit idmsa.org to donate. IDM, taking Islam to as many hearts and homes as possible.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042 203 1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
This Ramadan, as we fast in comfort, spare a thought for the millions of people struggling to survive. Muslim Hands has been serving humanity across 32 countries since 1993. We don't just respond to crises, we help communities build for the future. This Ramadan, let your zakat and sadaqah be a lifeline. Let it be hope. Donate with confidence at muslimhands.org.za.
world-class financial services only at Sapphire Global, your financial partner. If you are looking for Islamic, Sharia, and ethical financial products, look no further. Sapphire Global offers a wide range of financial service offerings from short-term to life and investments. A full-service center with all financial requirements under one brand. Our highly skilled and experienced consultants are ready to help protect your financial future. Contact us on 041 001 0184 or visit our website on www.sapphireglobalfs.com. Sapphire Global is an authorized financial services provider.
You are listening to Salam Media live from our headquarters in South Africa. This is Salam Media, keeping you company this Ramadan.
Assalamu alaikum and welcome back to the mid-morning talk with me, Sadia Ransedi. So getting back to our very interesting and informative interview with Sister Attiya Dadabhay. So how does an untreated hear loss affect children differently from adults, and particularly in school and language development?
Okay, so I think in terms of children, it obviously affects them in a variety of different ways. So from the age of 0 to 3 is the most important time in a child's life when it comes to acquiring language, and their brain is the most active to absorb new words, new sounds, and interact with the environment around them. So if a hearing loss is not treated in this time and or not picked up in this time, they might miss out on that critical period of language and learning development. When it comes to your older kids who are now in the school environment, remember a classroom setting is quite demanding. There's a lot of things that are expected from a child. So firstly, if they were not able to hear properly, they may not have acquired the appropriate language or speech in order to function in a classroom. Secondly, if they are not able to hear properly, when the teacher is talking from afar, when there's background noise or when there's other learners talking, they might miss out on pieces of information or not be able to hear what is happening in the classroom. And then they sometimes get labeled as, slow learners, or, they're not concentrating, or they're naughty. But some of the time it could be that, they actually experiencing a hearing loss and they're unable to cope or understand what is happening around them.
Yes.
And then when it comes to your older population, your adults, maybe even your teenagers, and then your elderly population, you notice with them that there's a lot of, withdrawal, social isolation, because they are aware that, they're not able to be part of this conversation or interact with the people around them. And then they start to withdraw because, someone will ask you a question and you can't hear what they're saying. You're constantly asking for repetition. You're constantly relying on lip reading to communicate with the people around you. And I think that this becomes a lot more mentally and emotionally draining for your older population.
Oh, okay. So, what can somebody expect during a hearing screening at Crown Med Day Hospital? And is it
Okay.
really quick and painless?
Yes, so it's quick and painless. It's only about 10 to 15 minutes that we spend with the patient. Remember, screening means we're identifying whether or not a problem exists. Okay, so we start off, the patient will come through and we do a brief case history just to establish whether or not there's any medical factors or, what's the patient's personal experience with their hearing. We then look in the ear and see, is there any wax obstructions? Is there any damage to their eardrums or their ear canals? We then run a quick middle ear test to see, is there any signs of middle ear infection or any problems with the eardrum that we're unable to pick up by looking into the ear. And then we do a basic hearing screening where we present sounds to a patient at the level we expect them to hear normally. Okay, so normal hearing is at a certain level, a decibel level. So we present a sound at that level at a few different frequencies, and we see whether or not the patient is able to respond to that sound. If they are able to respond to that sound, that means that they are able to hear within the normal range and they pass the hearing screening, and we recommend, an annual recheck. If there's wax in their ears, we try to, remove the wax or advise them further on that. And then if they fail the hearing screening or any one of the tests in the hearing screening, we recommend further intervention. So whether or not they need to see a doctor for an infection, or whether or not they need to come back for a full diagnostic hearing test, where we can identify exactly the degree of their hearing loss, the type of their hearing loss, how it's affecting their ability to understand speech, and then we can develop an appropriate intervention plan for that patient.
Okay, so for those who are nervous about testing, what's your reassurance for first-time patients?
Okay, so I mean, I would say firstly, don't be nervous. Maybe if it's something new, it can be a bit daunting, but I think it's always important to know your hearing status so that you know whether or not it's something that you need to manage. It's not
Yes.
anything scary, it's not anything painful, and just think about it as, doing your routine health check. Whether you're going to check your eyes, it's the same thing. You just need to come in and check whether or not your ears and your hearing is normal or not. It's really not scary. It's really quick and painless, and it requires not much from the patient. And it's really a quick process that can give you a lot of answers or guidance for what you might need to do in terms of your hearing.
Okay, so beyond this March initiative, what practical steps can families take to protect their hearing, like long term?
Okay, so I think prevention is very important. I think that even though, this is an initiative for March, I think if you are concerned about your hearing, or you are concerned about a family member who might have hearing problems, contact your local audiologist, or, try and arrange a screening for that. But I also think that just practicing safe listening practices or knowing the red flags for hearing loss is important. So educating yourself as to what are some of the signs of hearing loss and what are some of the things you can do to help prevent hearing loss. So in terms of the signs of hearing loss, I think that, you'll notice that people are either speaking at a very loud volume, or when they're watching the TV or on the phone, their volume is very loud. You can notice that in difficult situations to communicate are those with background noise. So situations like a restaurant or a mall or places where there's a lot of people talking at the same time, you might start to experience difficulty communicating in those settings. If you rely a lot on lip reading to communicate, that's also, might tell you that your ears are not working as well as they should. If you experience some ringing in your ears at times, that could be a symptom of hearing loss. And then remember that hearing should not be effortful. It should be something natural. You should not be fatiguing, trying to force yourself to pay attention to what someone is saying. If that is happening, it's important that you get your hearing checked. And when it comes to children, if you notice that they're not following instructions well, they're not developing language, they're not coping in the classroom, they have frequent ear infections, please bring them through for a hearing screening or a hearing test. And then just practice your safe listening practices. So if you're exposed to loud noise on a daily basis, make sure to wear hearing protection. Don't use earbuds or stick anything deep into your ear to cause any harm to your eardrum or your ear. And then I think another important thing for children is to make sure that parents vaccinate their children against viral infections such as meningitis, because a lot of these viral infections and ototoxic medication can contribute to hearing loss. So taking the preventative measures to prevent these illnesses or the need for antibiotics is quite important as well.
Oh, okay. No, Jazakla, that also answered like one of the questions that I had, which is like, how do you, like, after diagnosis, what's the management plan like to manage the concerns that are found in the screening?
Okay, so if there's any concerns found in the screening, we would firstly recommend a full diagnostic hearing test to identify exactly the degree and type of hearing loss. If it's a middle ear problem, an infection, flu, or some structural problems, we might refer you to an ENT doctor so that they can have a look and medically manage you first before we do anything else in terms of hearing management. And then for your older patients or your patients who have a hearing loss that is not really reversible through medical management, we would then either consider recommending a hearing aid or a cochlear implant for that patient so that they can get access to hearing through an assistive device.
Okay, no, Jazakla, that answers a lot. So we have come to the end of our interview. I just have one curiosity. Like personally, I have this tendency of sleeping with something over my ear because I have this abnormal fear that something will crawl into my ear. How possible is that? And how does one, like protect oneself from having things crawl into your ear, like especially while sleeping?
Okay, so it definitely is possible, and a lot of people do fear that because when you're sleeping, something can crawl into your ear. We don't see it that often, but I think that sometimes, I mean, sleeping with earplugs could be helpful or covering your ear, like you said. But a lot of the time there is foreign bodies that we do find in people's ears, whether it might be an insect or sometimes with kids they're pushing things into their ears, erasers and small little toys. So I think what you can do is maybe just educate children and educate yourself that it never stick anything into your ear, even as adults, earbuds. Some people use matchsticks, and some people stick things in their ear. So even if you feel like there's wax blocking your ear or something has crawled into your ear or there's something stuck in your ear, come straight to your doctor or your audiologist so that it can be safely removed. Because what can happen is if you are fidgeting or if you are pushing into your ear, it can cause further damage to your eardrum or rupture your eardrum or damage your ear canal. And those are things that you don't want that could actually contribute to permanent hearing loss. So I think firstly, maybe try not to sleep on the floor and you can wear earplugs when you're sleeping. But if there is something or a foreign body that you might feel in your ear, then please visit your doctor or your audiologist so that they can assess and safely remove whatever it might be in your ear. Even if it's wax, it rather come through to your audiologist so that we can syringe it or remove it safely without causing further infection or deeper wax infection towards your eardrum.
Okay, Jazakallah so much for this. We have come to the end of our interview. The information that you have shared was most certainly useful, and it helps for us to know going forward. Jazakallah for spending the morning, or rather the midday portion of your day with us, and we appreciate your contribution. Assalamu
Jazakallah so much. Assalamu alaikum.
alaikum. Okay.